Good morning. This is Dr. Chan here at Dentistry. We've been getting a lot of questions about smile makeovers. So today, my goal is to answer some of your questions about smile makeovers, and hopefully you'll have a better understanding of what that truly involves. So a smile makeover is just a term that we use in dentistry to talk about all of the procedures that are needed to try to give you a new and better and healthier smile. Now, it's a very general term, but it actually involves potentially a lot of different parts. It can involve moving your teeth into the right position. It can involve potentially reshaping or resizing your teeth so that they look better, sit better, and feel better. They can also involve trying to get your teeth into a position so that you're able to better eat and chew your food. So a lot of times people hear terms such as cosmetic dentistry, restorative dentistry. Smile makeover kind of falls into both categories because if you remember, we're trying to restore your smile to a smile that's happy, healthy, and functional. So I believe that when you have a smile that works well and looks good, then that's our goal for a smile makeover. And that can involve, as I said earlier, it can involve moving your teeth into the right position. So orthodontics may be involved. It also may involve reshaping or resizing some of your teeth. Maybe some of them are too big, they're too small, they're slightly out of position. Like I said, that can involve some orthodontics. It can also involve maybe putting some crowns or fillings or veneers on your teeth in order to change the shape and size of the teeth to something that's more pleasing to you and that works better for your mouth. So when we talk about a smile makeover, most of the time people think of something that's purely aesthetic. Oh, I just want my teeth to be straighter or wider or just better looking. Here at Crown Dentistry, we also believe that if your mouth is healthy and your teeth are healthy, then they're also going to look better. So our goals, first and foremost, are to make your teeth healthy and happy. We want to make sure that they're free from disease, they're free from infection, that they're also in the right position. So we also want them to be the right shape and size for your mouth. Sometimes people have teeth that they think are too small. We can work on trying to make those teeth bigger. Sometimes people think their teeth are too big. We can look at potentially resizing them or reshaping them so that they can look better to you and fit better in your mouth. We want everybody to have a beautiful smile here at Crown Dentistry, but we also want you to have a healthy smile. So first and foremost, we need to make sure that your mouth is healthy and that your teeth are healthy. And when I say that, I mean every teeth in your mouth. That means we want it to be free from cavities. We want it to be free from gum disease. So we need to make sure that before we look at making over your smile, we want to make sure that your mouth is healthy and free from infection and disease. So that would be the first criteria. Another criteria is we want to make sure that the rest of your body is healthy. So we want to make sure that you don't have any long-standing medical diseases that are uncontrolled, such as diabetes, high blood pressure. You do happen to have these medical conditions. We want to make sure that we're working with your physician in order to make sure that these conditions are under control. So that being said, if all of these conditions are satisfied, then we can definitely look at making over your smile. There are a couple of things that potentially could be involved in a smile makeover. It doesn't necessarily apply to every single patient. It could involve orthodontics, which means that we might be moving your teeth into a better position to make your smile look better. It could also involve putting fillings, crowns, or veneers on your teeth in order to make your teeth the shape, size, and color that you want them to be. At Crown Dentistry, we believe that healthy smiles are beautiful smiles. So if your teeth are free from cavities and free from gum disease, then we can definitely talk about proceeding with making over your smile to make it just as beautiful as you want it to be. So if we are looking at putting fillings and or crowns or veneers on your teeth, it's very possible that we will be using a little bit of anesthesia in order to make the procedure more comfortable for you. Sometimes though, we're able to make crowns, fillings, and veneers and place them on your teeth without using anesthesia. I realize that that's a very general answer, and honestly, it kind of depends on the individual patient. The best thing to do is basically to let us take a look at your mouth, and then we can individually tailor the procedure that's right for you. So in terms of healing time and recovery time from a smile makeover, if we don't need to reshape or smooth out your teeth, a lot of times the recovery after a smile makeover can be less than 24 hours. If anesthesia is involved, if we need to reshape or resize some of your teeth using some of our instruments, sometimes the recovery can be a little bit longer, but usually no more than 3 or 4 days. We definitely always encourage our patients to have good oral hygiene before, during, and after any kind of smile makeover procedure. After the procedure, a lot of times your gums and teeth may be a little sore. We usually recommend warm saltwater rinses, and we definitely want you to keep brushing and flossing. I usually just tell our patients to be gentle and kind around the teeth that we have worked on, just so that you don't cause yourself any undue discomfort. If you feel like you're a good candidate, or honestly, if you just want to find out some more information about smile makeovers, please call our office at 916-285-9678, or reach out to us via our website, www.crowndentistry.net, and we'd be happy to answer any questions that you might have.